There's a lot to discuss when it comes to this terrible, horrible, no good, very bad bill, especially given the repercussions to our healthcare system. But this isn't just about those of us who are chronically ill. This bill affects everyone in one way or another. Let's talk about it. By 2034, it's estimated that over 10.5 million people will lose access to their Medicaid. And this also includes the Children's Health Insurance Program. Over 330 rural hospitals that rely on this funding will close. Meaning, if you live in a rural area and you need access to a hospital for any reason, that access will become even more limited to you. And you will have to travel further to seek healthcare. Not only that, but the closing of this many hospitals will result in a reduction of the workforce of healthcare workers. This bill will also make it much more difficult for states to fund home and community based health services. These services are geared toward improving the quality of life of individuals who wish to remain independent and in their own homes. In 2021, 86.2% of long term services and support users relied on HCBS services. One in four nursing homes is at risk of closing. Without these services, more people will be required to take on caretaker roles, especially if their family members cannot afford to stay in nursing homes. This bill also seeks to add certain requirements to Medicaid, such as showing proof of work, community service, or school attendance. And people who do not have any of these can be penalized. Mind you, these paperwork requirements increase overhead costs, but they don't increase employment rates. Lastly, healthcare costs will rise for everyone, not just people who were on Medicare or Medicaid. Without the extension to the ACA tax credits, premiums for private insurance plans are expected to go up over 75% next year. This bill does not just affect those of us who are disabled or those of us who are elderly or who are children. This bill affects everyone. So, yes, you should care.